Hello, and it is April 11th. It is Saturday, April 11th. It's about 10:45 p.m. doing my little daily video. So primarily good news, I guess. I mean, as far as that goes, as far as the numbers go, confirmed cases are at 526,000. Deaths are at over 20,000. In New York, there's 181,000 cases, and in North Carolina, there's 4,354 cases. Now, why do I say that's good news? I mean, we've had 20,000 deaths, over 500,000 people infected by this. There are reports now that back in March, even March 31st, so just less than 2 weeks ago, they were predicting that there could be up to 240,000 deaths in America from this. And the new report that came out today said they estimate that number could be as low now as 60,000. And why were they so far off? Well, the answer is, I mean, the extreme measures that have been taken, the social distancing, the really kind of closing everything down and limiting exposure of this, it's working, apparently, according to their data and their models and stuff like that. And again, you would admit it makes sense. I mean, we're just not interacting with people, and so the number of deaths to go down is huge. The number of people that are going to be infected has gone down significantly. Not saying that everything's right in the world or where you can start celebrating, but it is what it is. So the other thing that it's kind of looking at some other local news or whatever, nothing really major happening. I mean, tomorrow's Easter, and so usually that's one of the big days where people, for churches, there's the line that people go to church on Christmas and Easter, and for some churches that's a big deal because that's they rely on the donations and stuff like that. And so to not have Easter services is kind of going to be hard on them, I would say. As far as my church, we continue to have our services at home and stuff like that, and we've been told that will continue throughout the month of April. And then we'll reevaluate once we get close to the end of April. So that's it. So it's kind of Easter Eve. As far as today, it was another beautiful day outside, so we got a lot of yard work done, mowed the lawn, trimmed the bushes, a lot of stuff that just needed to, it was one of those things where when we got done, it looked nice. The area of the house looked really nice. But it wasn't one of those things like, wow, look how great it looks compared to it did before, because it really wasn't that bad before. And that's kind of, I guess, the point I was trying to make with my kids today is, we don't necessarily have to let something get really, really bad, to keep it, in check. And so that's, as we take precautionary measures and we're just kind of doing the stuff that we're supposed to do on a regular basis, it can prevent things from getting really bad and to the point where we have to do major drastic measures. How does this relate to COVID-19? Well, I mean, we've had to make some pretty drastic measures as far as, with this pandemic. Are there things that could be done? I think, what this will do is hopefully shine the light on the medical industry. I mean, the fact our medical system is broken. It is bad. It is really, really bad in America. We medical people are it's a for-profit organization, and so it's just every year costs go up. Every year, benefits go down, and it's like you're one step away, one accident away from really losing everything you've worked for your whole entire life, because that's how expensive medical stuff is. I don't have an answer. I'm not the person that has an answer, but what we have right now is not working. There are countries around the world that have much better healthcare systems than we do, and I'm just saying. But anyway, don't want to go off on too big of a tangent. So hopefully this will kind of rattle some cages, as they, after the aftermath, and they kind of look at what happened, what could have been prevented, what, where our shortfalls are, and recognize we have a pretty crappy, really pretty terrible, healthcare system as far as who has access and, stuff like that, and maybe do something about it. So anyway, that's it for April 11th, 2020. And